My name is Jimena Loveluck, and I'm the Health Officer for the Washtenaw County Health Department. Thank you for joining us for another COVID-19 video update. Unfortunately, the Delta variant is spreading throughout the county and is circulating locally. As of August 19th, Washtenaw County is at a substantial level of community transmission. Most neighboring counties have moved to a high level of transmission. We have strongly recommended masks for everyone in indoor public spaces while spread remains substantial. At the Health Department, it's our job to share information about current disease trends and make recommendations that protect all of us broadly. This isn't meant to cause alarm, but it is time to take preventative actions and work together to prevent additional harms from COVID. We need everyone's leadership and partnership to reduce spread as much as possible and reduce negative impacts. The Delta variant is highly contagious, and though we are fortunate to have a relatively high vaccination level locally, we know not everyone in our community is protected. The good news is that we have effective tools to minimize the harm COVID-19 can bring to our community. We're in a different place than we were earlier in the pandemic. We have effective vaccines, and we know the actions we can take to limit spread. Though many of us are tired of COVID, we must continue to use that guidance. By doing so, we can keep our current cases from fully surging. Plus, the more we can contain overall spread, the less likely it is that additional variants will develop. Vaccines are proving to be extremely effective at preventing serious illnesses and deaths related to COVID-19. Our COVID-related hospitalizations are primarily among people who aren't fully vaccinated. Even among those vaccinated, some breakthrough cases are expected because, like all medical interventions, vaccines are not 100% effective. The vaccine's first job is to prevent serious illness or death. Getting vaccinated is the best thing we can do as individuals to protect ourselves against COVID-19. As your local public health department, we're also looking out for our overall community's safety. That's why we are strongly urging everyone, vaccinated and unvaccinated, to wear a mask in indoor public settings. When local levels of transmission are elevated like they are now, these additional prevention measures prevent spread and further protect everyone from COVID-19. Remember, there are plenty of people in our county who are not yet vaccinated, including all children under 12 who are not eligible yet. By actively working to prevent further spread, we can protect others while also avoiding overwhelming our local healthcare systems, keeping our schools open for in-person learning, and buying time for more unvaccinated people to get the vaccine. We have the tools to limit the harm COVID-19 can bring to our lives, and we need to keep using them. Lately, we've seen a slight uptick in people getting vaccinated against COVID-19. If you felt like you wanted to wait and see when the vaccine started rolling out, you're not alone. We've been able to see the real impact vaccines have made in preventing serious infections among vaccinated people. The vaccines are safe, free, and now easily accessible across the county. Check out our website for vaccine information or talk to your doctor about any questions you might have. With our high local cases, the Delta variant circulating, and kids heading back to school, now is a great time to get your vaccine. The CDC has recommended that significantly immunocompromised people who get either the Pfizer or Moderna vaccine or got the Pfizer or Moderna vaccine get an additional vaccine dose. This includes people who've received an organ transplant, are undergoing cancer treatments, or who have another serious immunosuppressive condition. We are now giving additional doses to immunocompromised people at our ongoing health department clinic at 555 Towner in Ypsilanti. We strongly encourage patients to talk with their primary care doctor or treatment team before getting an additional dose. Your healthcare provider can help determine if an additional shot is needed and, importantly, determine the appropriate timing of an additional dose. People who aren't immunocompromised do not need an additional vaccine dose right now. No extra doses are currently authorized for the general population, but booster doses will be coming soon, and we'll be sure to share more information on that when we have it. Last week, the CDC strengthened their recommendation for pregnant people getting vaccinated against COVID-19. Vaccines are especially important for pregnant people because they are at increased risk for severe illness from COVID. Pregnant people with COVID are also at increased risk for preterm birth and might be at increased risk for other adverse pregnancy outcomes. Plus, vaccines can protect babies once they're born. If a pregnant person gets vaccinated, there's increasing evidence showing that babies also get protection from COVID. If you're pregnant and have questions about COVID-19 vaccines, we encourage you to talk to your healthcare provider. We continue to host pop-up clinics across the county to make it as easy as possible to get vaccinated. We also have an ongoing walk-in clinic at 555 Towner in Ypsilanti on Tuesdays, Wednesdays, Thursdays, and Fridays. Our website remains the best place to get up-to-date information on vaccine clinic locations and hours. Anyone can also call us at 734-544-6700 to get connected to COVID-19 vaccine resources. Everyone 12 years old or older can get vaccinated. Anyone under 18 will need a parent or guardian present to get vaccinated through the health department. Many pharmacies and local healthcare providers are able to give COVID-19 vaccines. Remember, free transportation is available for anyone who needs a ride to a vaccine site. Just call 844-900-4882 and use the code VACCINATE-WASHTENAW to book your free rides. Last week, we shared our guidance with local schools on safe in-person learning. We support the CDC and MDHHS recommendations for layered prevention strategies, including universal or required masking for everyone in K-12 schools, regardless of vaccination status. As a community, we can all help keep our kids learning in person by getting vaccinated, wearing a mask in indoor public settings when we're seeing increased case levels, getting tested if sick or exposed, and following isolation or quarantine guidance when appropriate. Our complete school guidance is available on our website. We also encourage our community leaders, businesses, and organizations to do everything they can to support and encourage vaccination and appropriate prevention strategies. Offer time off, incentives, or directives as makes sense for your business or organization. COVID is likely to continue to circulate, but we can prevent many of the most serious impacts. As of August 17th, over 91% of Washtenaw County residents 65 and older and over 66% of individuals 12 to 64 have received at least one dose of vaccine. Over 88% of residents 65 and older and about 61% of residents 12 to 64 have completed a full vaccine series. The most up-to-date COVID-19 information is always available on our website, social media channels, and email updates. Thank you for watching, and stay safe.